7 questions to ask before getting breast implants. If you're thinking about breast implants, save this video because these are the questions I wish every woman would ask before putting down a deposit. Hi, I'm Ella. I worked as a plastic surgery consultant in Beverly Hills for 10 years, and I've helped hundreds of women through consultations, surgery, and recovery. And after doing this for that long, I've noticed something. Most patients know how to ask, how much, and what size should I get? But those aren't necessarily the questions that protect you from being disappointed later. So I narrowed it down to 7. And I actually made these into a free checklist for you. So you don't have to remember any of this. I'll tell you exactly where to get it at the end. Question number 1. Why are you recommending this implant for me? Not which implant is the newest, not which one your friend got, not which one is trending. I want to know why this particular implant makes sense for my body. Maybe it's my chest width. Maybe it's the amount of tissue that I have. Maybe it's because I want a very natural look versus a fuller, rounder look. There should be a reason, and you should understand that reason way before surgery. Question number 2. Can you show me patients who started off like me? This one is one of my favorites. When you're looking at before and afters, stop only looking at the after. Look at the before. Was she built like you? Did she have similar amount of breast tissue? Similar spacing? Did she breastfeed? Was she starting off asymmetrical? Because a beautiful result from someone who started completely different than you doesn't nearly tell you as much. I want to see what you've done with my type of starting point. Question number 3. What part of my inspiration photo might not be realistic for me? Bring your inspiration pictures, please. They really do help tremendously. But I also want somebody to tell me when they can't recreate it, because that woman naturally has more close cleavage and you don't. Or maybe she has more breast tissue. Maybe the result that you're showing actually requires a lift. I'd much rather hear this part isn't realistic for your anatomy before surgery than to discover it afterwards. Question number 4. What changes if I go bigger? Because inevitably we find a size, we like it, and then it's like, okay, but what if I go just a little bit bigger? Totally normal. But bigger doesn't only mean more boob. It can change projection, width, weight, how much your skin stretches, and sometimes the overall look you originally asked for. So don't only ask, can I go bigger? Ask what you're actually changing about your results by going bigger. Question number 5. What will my breast realistically look like without a bra? Because your breasts do not live in your Fashion Nova top. LOL. A lot of inspiration pictures have push-up bras, bikinis, tape, posting, lighting. I want to know what mine will actually look like when I'm standing naked in front of the mirror. How much natural cleavage can I expect? How will they sit? How much upper fullness? What will they look like from the side? That's the result that you're actually living with. Question number 6. What happens if I find a concern after surgery? This question isn't as fun. Who's taking care of you after surgery? How often are your follow-ups? Who do you call if something doesn't look right? What happens if you need to come into the office? What does your implant warranty actually cover? I've been on the other side of those nervous patient phone calls. Trust me, when you're 3 days post-op, worried about something, you are going to care a lot about those answers. And question number 7, based on everything you know about me, is this actually something you'd recommend? This one might be the most important one, because sometimes what you walk into the consultation asking for isn't exactly what you need. When you think you need a lift and you don't. Maybe you think you don't need a lift and you do. Maybe you're convinced you need 450 cc's and after looking at your anatomy, that's not going to create the result that you're showing us. You want a surgeon and a team who are comfortable telling you, I know that's what you asked for, and here's what I would recommend instead. That's super valuable. And because I know that was a lot, I put all these questions into a simple checklist so that you can literally pull it up on your phone during your consultation. You don't have to memorize anything. Grab it through the link in the description, save it on your phone, and take it with you when you're meeting with your surgeons. I want you walking into these consultations knowing exactly what to listen for. And for those of you who are already considering breast augmentation, we currently have a Motiva 20 opportunity here in Beverly Hills. It's a limited time opportunity for patients interested in Motiva breast augmentation to access preferred promotional pricing while still receiving the same customized surgical planning and experience. You don't have to know yet whether Motiva is right for you. That part we'll figure out together. Message me Motiva20 and I'll personally send you the details and help you understand what your options really look like. We only have limited availability under this offer, so if breast augmentation is already something you've been planning, reach out to me while it's still open. And you can also follow me on Instagram and TikTok at Elevate Consulting. After 10 years in plastic surgery, my goal is pretty simple. I want you to walk into your consultation prepared enough to ask better questions and confident enough to understand the answers. Grab the checklist below, and I'll see you in the next video.